Hello, my name is Dr. Brian Reid, and I am a naturopathic doctor, and this is a video about implementing mitochondrial support, or as I like to phrase it, comprehensive mitochondrial support into a patient case. So comprehensive mitochondrial support can be implemented at various phases of the treatment protocol for a patient. In some cases, we implement it right out of the gate. Sometimes it's midway through treatment, and sometimes it's to help kind of put the finishing touches on a case to help resolve the any residual symptoms that might be kicking around. So just to illustrate by example with a case from my practice, an example of sort of that third scenario where this patient, they've been suffering from complex chronic illness for a number of years, about 15 years or so. They had originally had a diagnosis of fibromyalgia or chronic fatigue syndrome, and then it took about 10 years or so for them to find an integrative healthcare practitioner to then kind of look at their case with fresh eyes and run some testing, and and this patient wound up being diagnosed as having issues with persistent borreliosis, so aka chronic Lyme disease, some co-infections, some viruses, so kind of like a full gamut of things. So this was with a different clinician, it wasn't with me. And so this patient worked with those protocols, and over the span of a couple of years got to the point where they were feeling quite a lot better. Energy levels were about 50% improved. The patient was able to work again. Pain levels were still present to a significant degree in certain body areas, but the diffuse pain that had been plaguing virtually every muscle and joint was concentrated mostly just to a couple of body regions, so like some spots in the person's back, and I think it was one or both shoulder joints, I can't remember off the top of my head, and there were some other symptoms as well, like headaches and brain fog and different things like that, but overall the patient was doing a lot better. But the patient had been kind of plateaued at that point for the span of a couple of years, and so they came to my practice just to see if I had any insight to add to their case. And so with this patient's case, we chatted, of course, and took a look at took a look at the history. And one area that hadn't been explored that I thought was relevant, we did testing, and it turns out yes, indeed, it was relevant. Was an underlying issue with mold. So that was something that hadn't been identified. But the other thing that was coming up was that it just sounded like the patient was fairly mitochondrially depleted. She was doing a lot better overall, but her energy levels were still just not where they should be. There were still some residual symptoms with brain fog and things to that effect. And looking back at the treatment history, there was a lot of detox work that had been done, a lot of killing work that had been done, and certainly some support for adrenal glands and supporting detoxification systems and whatnot. However, there wasn't any type of, some B vitamins and things like that, but there hadn't been comprehensive mitochondrial support, getting nice robust dosages of all the vitamins, minerals, antioxidants, and amino acids that are necessary for the mitochondria to work optimally, plus some of the bonus nutrients like creatine or ribose or things like that to really help just get those mitochondria back to tip-top shape. And so with this patient, my recommendation was, go on some comprehensive mitochondrial support. Let's see how you're doing after a couple of months, and then at that point, maybe let's start plugging away at mold in their system. And so after a couple of months, much to the patient's pleasure and much to my delight, the symptoms were doing better. Energy levels were, had been sitting around a 5 out of 10. They're more consistently around an 8 out of 10. Pain levels are markedly diminished, like almost non-existent. Brain fog mental clarity is better. Sleep is more sound. And overall, the patient is doing a lot better. So still not 100%, but given that there had been sort of a plateauing for a couple of years, and then in the matter of a couple of months, there was that marked further improvement, to that kind of spoke to me as indication that we needed some mitochondrial support was probably missing. Some like tissue healing and replenishment and rejuvenation was part of what was missing. So in this patient's case, we're still going to look at molds. Biofilms hadn't been addressed historically. There's a few things that we're going to check, just look at working on just to see if there's any other roadblocks to the patient feeling 100%. But it seemed like the mitochondrial support was a really useful adjunct to get into the mix.